So when everybody's going to be doctor today, so when Dr. Dong invited me to do this, I realized it was a fairly daunting task to take on in an amount of time that we have. And I also was very pleased that Dr. Cherno set me up for this, because I know that at some point in our history of a relationship together, Dr. Cherno and I have had many discussions about theoretical frameworks and their place with research and practice. So beautiful that he did that. I was most pleased because I was expecting a knife from somewhere to come from him about this. I want to thank you all for being here and to tell you what a tremendous honor it is to be able to speak about this topic. But I would like to acknowledge a few folks before I begin who have helped me think about this, both for this presentation and for a period of time, and that would be Elizabeth Podnix, Georgia Annetsberger, whose birthday is today, by the way, Karen Roberto, Arlene Johnson, Jeff Hall before me, and my colleague right across the hall, Dick Clayton, who admonished me when I told him that I would speak today to be bold. And so there you have it. Dick, if you're not listening, I know you're not, but I want him to know that we'll see if I was bold about what I had to say. All right, so before us then is a discussion that I will present on the promise and peril of conceptual frameworks for elder abuse. I hold tight to the promise, but I would be not truth in advertising if I didn't tell you about some of the peril of some of them. And I expect that we will have questions about them as we go forward. So I will go ahead and move forward. Let's see. Now, the thing I never did do is decide when you go forward. So let me make that next piece. Those of you who know me fairly well know that I usually do quotes. So I'm sure that comes from a liberal arts early background. And that would just be to remind you that all of us have a test of how we treat individuals in all our countries across the world, because we deal with children, we deal with young adults, older adults, all persons of all ages, and that is the measure of the quality of a nation and the quality of individuals as well. So this particular slide is to give you information in a United Statesian way of data, and Dr. Kalachi has talked about that in other countries as well as others. To simply say this to you, there is, as he said, across the world a rising population of older adults who then are available to be abused, who are available to abuse others, and cohorts of individuals, as Dr. Cherno said, often folks in the community who could be the abusers, the offenders, or the perpetrators, or other names that we might call them. We know from the work of many of us around this room and others that we believe abuse occurs more predominantly in community settings and more predominantly by family and friend members than other individuals. We still have a long way to go, however, in understanding the nuances of those types of mistreatment. Those types of individuals who may be the offenders, the abusers, the perpetrators, can also be spouses, can also be other intimate partners, can also be carers, can also be paid, can also be providing volunteer services. All those individuals in community settings or in facility settings can be potential victims and can be potential abusers. And so what this says to us then is what we need to do, what we need to think about is how we conceptualize the problem. And certainly we have any number of conceptual frameworks to consider. I chose a number of them to think about. I hope I catch every one of you and your disciplinary heritages by the time that I conclude here in a very short amount of time. So one of the issues I think that Dr. Cherno set up pretty nicely for me is one that I was going to raise. Where do we go, and Dr. Dong, where do we go in? And here in my approach would be, are we going to be looking at individual level theories that would explore essentially some dyadic relationships or triadic relationships of individuals in an abuse environment, or are we looking at broader frameworks which look at a sort of worldview, or do we marry those, or how do we do that? So listen on. Why should we consider conceptual frameworks? Only last evening, doing public health capstones for master's students, did we again have a discussion of why theory and conceptual frameworks matter. I'm not sure I convinced them. They were just happy to get their MPHs and move on in a celebratory way, but nevertheless, we felt it was important to once again drive something we wish to perpetuate home. So why should we consider conceptual frameworks at all? And I think you begin to see some of these issues as you see them carried out both in research and practice. How do we approach the problem? And those conceptual frameworks will guide what we're going to do about them. Elder mistreatment has been described as atheoretical. You could certainly do elder abuse work and never have a theory cross your doorstep if you wanted to, although I think that would be problematic. Is it atheoretical because it's easier to do it that way? You're not a believer in theory? Or is it because the theoretical frameworks that we have simply don't capture the etiology of the phenomenon itself? I would bet the latter necessarily, or the contextual frameworks that surround it. No grand theory exists of elder abuse. Do we go after that bright shining star? Or do we combine those we already have and improve upon them? Do we need to consider in conceptual frameworks very basic essences of what we consider to do in our work, and that would be the nature of things that have existence, such as ontological considerations. That would be the thing that we have, the thing that we have before us, which is elder abuse, as well as the nature of knowledge and justification itself. How do we acquire knowledge? What is reality? What is elder abuse? You see this tempered in every presentation that you have had yet, and I bet you in every one that will come before you. Yet I would say, just as I said to my students last night, organizing frameworks can and do define approaches both theoretical and applied, and it keeps us from having to reinvent the wheel or fire, or make fire stronger. It will not be unusual to several of you around the room that I would probably start with the ecological model, because several of the conceptual frameworks we have take this model into account. It is used and embraced by many disciplines, in particular the one of the college in which I come from at this point, which is a college of public health. So many of you public health folks will know this one and will wonder why I couldn't get the I to become a blue color before you when we think about the nested systems here. What you will see here is a descriptive model which begins to try to take along not just individual level approaches to the problem, but one that has concentric rings which grow larger, microsystems through macrosystems, and a chronosystem as well. I most use the work of Yuri Bronfenbrenner when I look at this particular aspect, and have Dr. Campbell when I looked at some issues of intimate partner violence in rural areas for midlife and older women. So how does this particular approach help us explain the issue of elder abuse? And what's nice about it is that it takes many levels of things into consideration. It was, at least for Bronfenbrenner, originally conceptualized for children, but it is nicely applied and has been in a number of articles for mistreatment of older individuals as well. It provides a multi-level, nested, and I would say systems approach, because I think other disciplinary heritage embrace that, to considering the problem. And it highlights the importance of levels or layers of thinking. Although there is with every way we approach the issue things to think about or improve upon. One issue here is it is very difficult to measure all of these types of systems within a particular article. I could only say in my own individual experience, any article I ever proposed to publish and try to fit any qualitative or quantitative analysis among the nested systems. The best I can do is hit the bullseye for a few of those rings, I think, if I were honest. then systems are not necessarily intersecting in that particular model. I'll go back to it. The systems are not necessarily intersecting, but rather nested. And of course, your question here would be, do they in fact intersect, or are they nested in themselves? And we can certainly debate that, but that would be an issue to think about. The idea of time is not necessarily always treated well in the ecological model, but a chronos system would have to do with all these particular rings. And yet this is difficult to measure. So all these ways of thinking about elder mistreatment, from the level of the individual through the level of society and culture, become quite difficult to measure and quite difficult to decide, again, as Dr. Dong said, where you put the knife, or I would say where you dive in the pool. You go in the deep end or the shallow end is sort of the way I tend to think of it, but I'm sure that has to do with my early history as a lifeguard. So let me just say that. So do we think about the political environment and ignore the issues of the family? How do we embrace all those particular levels? That is this approach. Moving on, and somewhat uncomfortably, is to talk, but I was asked to do, about the NAS Sociocultural Framework. And what is terribly important about this particular model is it's about elder mistreatment. It is taken from a book which now is so old and used on my desk that the spine just broke last week. But I would acknowledge Richard Bonney and Robert Wallace and the group of people, many of whom are in this room, who worked on that particular book and published it in 2003. And so this has some similarities to the ecological model, but it discusses a context of abuse. It takes into account, and importantly so, individual SES issues, and in particular health of individuals. It examines the inequalities that are set up in those particular frameworks, and it talks about both individuals and trusted others in relationship. And so a relationship becomes an important piece of this particular model. Quality of life does, and the authors were wise to think about outcomes in this particular model. And security and changes of that. So some pieces of time. So again, specifically designed to explain elder mistreatment, considers a variety of contributors to the mistreatment. I think a hallmark, an important piece of this is elders in relationship with others, dynamics of power and exchange, includes outcomes. And the elephant in the room, of course, already alluded to, is the issue of the trusted other. That will, I'm sure, take on some more discussion later on as we proceed through this workshop, but it has been an issue of contention in the way that has been framed as having to do with the types of abuse. The issue being, when does the trust relationship occur? And in particular, to define this kind of mistreatment as opposed to including or embracing self-neglect. Issue of time may be something that needs and bears more consideration, I think, in this model, and a deeper consideration of the characteristics of the abuser may be an important component that could be added. The next model I was asked to speak on was early work by Lenore Walker in the 70s, a researcher and feminist, to try to describe the cycle of violence theory, applicable particularly to intimate partner violence. Certainly more elegant approaches to this have occurred. This was based on theories and interventions. This was based on interviews she had with women who had survived an abusive relationship. It is an individual level theory at this particular, as presented here. It is derived from the domestic violence literature. It remains controversial. It is somewhat situational, yet it has great strength in that it's easily comprehensible and reflects a pattern. It does reveal that not everyone who would commit elder abuse was, one piece of this component is a person who had been abused before, or a stressful relationship. So not everyone who would commit elder abuse would have been reared in a home in which violence took place, would be something to think about related to this particular theory. It could excuse the perpetrator from culpability, and support is inconsistent for this approach. It, of course, has been refined. The last of the major theoretical constructs I was asked to speak about is the life course perspective. Those of us who are gerontologists know this perspective very, very well, and know certain components of it as age, period, and cohort. it would explain older adults in situations over time, and begins to give us a history and a context in which to view the issue of elder mistreatment. Life course perspective has been applied to many issues, particularly obesity and smoking, not so much for public health, not so much for elder mistreatment, but certainly could be. Issues related to the life course perspective would include a context for action and intervention, something we may not see in some of the other approaches that I've discussed. There are a multiplicity of ways to apply. I was very careful. I have had long arguments in halls that you cannot imagine over saying the life course approach is a perspective, not a theoretical approach. I hope you won't ask that issue today, but take me out in the hall and I'll give you a long discussion. Misapplication of central tendency is a problem here because it tries to normalize the behavior of a period of adults into the mean, far from it in a heterogeneous population. Social change and social forces confound some of the findings that we may have in the life course perspective. So I already primed you on the heterogeneity issue. It does in some ways confuse time with change. Time doesn't necessarily equate to change. And it problematizes individuals and choice environments. Many of you will recognize some of these pieces, which I absolutely borrowed from Google Images. Then I would want to talk just a moment about other constructs. One would be borrowed again from our intimate partner violence folks who talk with us a great deal about the power and control wheel, so that we begin to understand issues of elder mistreatment within a context of what is privilege, what is power, and what is control over individuals who may be more vulnerable than others. And those particular issues we've already heard discussed, such as vulnerability that may be physical, vulnerabilities that may include dementia, and vulnerabilities that may include place, and those vulnerabilities that may include SES. There are some particular pieces here. I also selected a few other theoretical constructs for us to consider while I had you. And so I thought I would just give you a discussion shortly of these ways, again, to think about the issue of elder mistreatment as we frame the problem, which guides us about where to go in to deal with the issue. One would come from Ken Ferraro's work in 2009, and that would be cumulative inequality theory, meaning that an individual had over time, and particularly an older individual, had accrued a number of constructs in his or her life that may put him or her at a disadvantage. He did change that from cumulative disadvantage to cumulative inequality, and the nuance is important. And it would be important, and you can ask me why when I finish if you wish. Social exchange theory is another approach to begin to think about individuals. It has been used with elder mistreatment. It may be easily applied a lot to particularly financial exploitation, in which there are negotiated interactions between individuals that may create why an individual would move into a particular exploitive relationship or not. Caregiver family stress. I was scared to put this in because I have known people who have taken it out of articles for peer review lately because it has fallen into some disrepute, but I can't quite get it to go away. And so I think we need to talk about what this would be. As it was conceptualized, it was objective and perceptive of a burden of being a carer and a reaction to that. The way out of that would be to support caregivers, and you know why we begin to worry about that particular construct, because the issue moves to blaming the victim. Hence, we have moved to other approaches in this particular field to think about, and yet I think we need to think about this one again and how it may be useful or how it may be helpful in conceptualizing intervention. Other approaches would be a neutralization approach. I want to sort of cite some books and concepts here. One would be Quinn and Tomita book that you probably have on your shelves from 1997. That's another one that's just about taped up for me. And in this particular piece, it was to try to explain, and it's important here, the what the perpetrator or the abuser would do and why, because we don't have so many of those particular approaches to the abuser. Bad person, deviant person. Neutralization theory would talk about an individual who is not so necessarily deviant, but one who may, in fact, deny responsibility, deny that injury is occurring, deny that the victim is not responsible, and abrogate oneself from responsibility in the abuse that may occur. Then a person then would act because that individual was appealing to peer pressure, if that occurs, or the necessity of doing the abuse, committing the abuse at all, the mother of the justification. Other approaches that would be useful and helpful to us, many of us in this room, the public health model of different aspects that we know very well. The hallmarks of public health would be primary, secondary, and tertiary prevention models, the use of surveillance, the use of epidemiology, the identification of risk factors, the importance of screening, and the not without which of importance of education, and something that you have alluded to, the importance of political and community action. And so the public health model is the big picture. It is not individuals. It is about populations and the public. It, however, needs money and advocacy, and it is a lot about preventive issues. Another approach that we may consider, and I think this one is nice, I'm sorry, let me jump back. I think this one is nice because it's a little bit different than the others. I cite this in Lisa Nierenberg in her text on elder abuse prevention, emerging trends and promising practices, published 2008, did a nice job of discussing what restorative justice is, rooted in Native Indian cultures, Native American cultures, and this is a negotiation kind of approach to elder mistreatment. It is reminiscent of some tikkun olam, if you will, from the persons of Jewish heritage to repair the world, to repair the relationship. And so this may be another approach to thinking about elder mistreatment. Adult Protective Services, I could not look at colleagues who are in elder mistreatment and who have not labored hard from NAPSA in this room without thinking about the Adult Protective Services model, primacy being safety for individuals, but the conundrum of upholding individual rights while trying to promote that. And the hallmark of elder mistreatment, the hallmark of the Adult Protective Services model, which is the home visit, the review of the case, findings, and so forth. And yet, none of us in this room would not admit that caseloads for those individuals are huge, unfunded, and becoming more complex all the time. And I would want to also mention at this particular time the very safety of the individuals who labor to try to make individuals safer is more and more compromised. There, I said it. Ethics of care is a feminist theoretical model. Don't exit the room on this one. But I would want to say this is work of Nell Noddings, in particular of individuals who begin to think about right treatment of collective action for what is appropriate for individuals. I believe we have much to pull from for ethical treatment of individuals and marrying ethical approaches into our conceptual frameworks. It's about time. I did in one grant, not as well as I should have, Dr. Stahl. Then I would also add economic theories, because many of us in this room, MT, I can't find you right now, but many of us in this room recognize the importance of marrying economic theories, cost-benefit analysis, costs and gains, and interventions to nudge decision-making can be very useful in using economic theories to help us. These are a smattering of approaches to theoretical constructs that we may continue to use or may begin to use in approaches with dealing with both research and applied approaches to the problem. Our problems are legion. Our population of target is growing. Is there promise? The promise lies in the conceptual frameworks that we choose to use or marry. Is there peril? Yes. There are deficits to each. Is it a theoretical world? I think not. I suggest then to leave you with some important thoughts, and I know you have many already sitting there in your heads. One would be the importance of transdisciplinarity, not inter, not multi, but trans. That means we supersede our heritages and come together on common topics. Not an easy task. I suggest that we marry approaches, thinking, for example, of ethics and ethical theories and economic theories to drive some of the work that we do. I suggest that we think a little less United Statesian and a little more global, and some of these particular theoretical constructs lend themselves exceptionally well in this particular domain. I suggest that we may have to think about theories differently for community abuse as opposed to institutional abuse. For individuals who are capacitated, mildly capacitated, and not capacitated, I think we will have to think about constructs for protecting their individual freedoms and keeping them safe at the same time. I suggest finally that our models need to consider both upstream issues and downstream issues. We have been largely focused on of identifying what is abuse and what we should do to address it. But I believe that these issues about which we think and we conceptualize occur far more upstream in the prevention realm than we have taken thus far, and also that downstream, and again, Dr. Chernow, that we begin to think about what are outcomes of the mistreatment. Health, what protects or promotes that downstream from an abusive relationship, what keeps it from cycling back again and again and again, as it often does. And so I leave you then to begin questions that you need to ask. And I admonish you to think that these conceptual frameworks will then guide our very verbiage and thinking about this issue. So, is there a victim? Is there an older adult? Is there a woman? Is there a man? Is there a perpetrator? Is there an offender? Is there an abuser? Or is there a person? Thank you.